Good morning, everybody. I am Victoria Lancy, the Rural Education Manager from MCRH, and I would like to welcome everyone to our macro MIPS and APM's education management series. Education series. Our topic this month is Advancing Care Information Category. Just a few reminders. If you are logged into the webinar portion using the link provided, you can listen to the audio through your computer speakers. If you are participating via the phone number provided, don't worry, we are recording the webinar, and the recording will be posted on the MCRH website at www.mcrh.msu.edu. Click on the Resources tab across the top, then click on the QPP drop-down. If you'd like to ask a question during the webinar, you can type it into the chat feature and then I will relay your question, or you may ask it during the Q&A component at the end of the webinar when all lines are unmuted. With that, I'd like to introduce our speakers from Hall Render, Killian Heath and Lyman, Brian Bauer, and Lisa Lusudo.
Hi everyone, good morning. Thank you so much for joining us for part 4 of our MIPS and Macro webinar series. Today, we will be focusing on a deeper dive and giving you a high-level better understanding of the Advancing Care Information category. So throughout our webinar today, we are hopeful that you will learn a high-level understanding of this reporting category for MIPS, the Advancing Care Information category, or otherwise known as ACI. This category is quite complex, so we'll do our best to drill this down in a way that you can take away and understand. So there are 3 components to the ACI score that are really important that we'll go through in greater detail today. The first is the base score requirement. So we'll talk about how the base score is calculated and what the base score means. The next component is the performance score. Again, we'll discuss how that's also calculated into the total ACI score. And then finally, there are bonus score opportunities as well that will compromise your ACI score. We'll go through a couple of scoring examples for you because the scoring is quite complicated. So we'll walk you through some practical examples of how you or your group might be scored. And then we'll wrap up the presentation by discussing some tips for you and your practice to maximize points in this particular category. So just as a refresher and a reminder for everyone, especially those of you who may be joining us for this webinar, the MIPS program and the performance year for 2018 is comprised of 4 different performance categories. So as you can see, the Advancing Care Information category represents 25 out of the potential 100 possible final score points for the MIPS program. So it represents about 25%. And as a reminder, for those of you who already know, and for those of you who don't know, the MIPS final score is totaled by all of these categories and how well you do in each. You have a potential of 100 possible final score points. That's compared against a performance threshold, and that will ultimately determine if you or your practice is going to receive a positive, negative, or neutral payment adjustment to your Medicare Part B payment. So just by way of background, the ACI category was replaced by the Medicare EHR Incentive Program, also known as the Meaningful Use Program, which I'm sure many of you are familiar with. So CMS created the Advancing Care Information category with the goal of giving providers more flexibility when selecting measures, rather than what the Meaningful Use Program had to offer. So this is really designed to give you and your practice a better opportunity and chance to score more points in this particular category. As I mentioned earlier, the ACI category is comprised of a base, performance, and bonus score. And again, in 2018, this performance category is going to be worth 25% of your MIPS final score. So for performance year 2018, there are going to be 2 different measure set options for you and your practice to choose to report on. The first is known as the Advancing Care Information Objectives and Measures, and the second is called the Advancing Care Information Transition Objectives and Measures. And it'll depend what option you'll use to send in your data based on the addition of your certified EHR technology. So you would report under the Advancing Care Information Objectives and Measures if you have 2015 certified EHR, or if you have a combination of technologies that are certified to the 2014 and 2015 editions that would support these measures. Otherwise, you would be reporting under the 2018 Advancing Care Information Transition Objectives and Measures, and you would report under the transition measures if you have EHR technology that's certified to 2015 edition, or you still may have EHR technology that's certified to the 2014 edition, or you have a combination of technologies that are certified to both 2014 and 2015. CMS recognized that many practices and providers haven't yet upgraded to the 2015 edition, so you're still able to report under the ACI category under this transition option if you happen to still have 2014 EHR. In the 2018 performance period, clinicians and groups that exclusively report under the Advancing Care Information Objectives and Measures will earn a 10% bonus for using only 2015 certified EHR. So if you do happen to have 2015 certified EHR, you will be eligible for a 10% bonus that's added to your total ACI score. So now we'll talk about the base score component and how that is calculated. The base score component is really ultimately the threshold here for the ACI category and is very important and integral to your success in this particular reporting category. So in order to be successful, you'll need to meet the requirements of all of the base score measures in order to receive the 50% that CMS has allocated towards the base score. If these requirements are not met, you will get a 0 for the overall ACI category. So again, very, very important that you meet the minimum requirements for the base score. And fortunately, CMS has made it pretty easy for providers to meet those requirements, which we'll discuss in the next few slides. So in order to receive the 50% base score, you'll need to submit a yes for the security risk analysis measure. And you'll need to perform each of the 5 advancing care information measures that are noted below. You'll need to perform that action on at least one patient. And as you can see, the 5 advancing care information measures are security risk analysis, e-prescribing, providing patient access, sending a summary of care, and requesting and accepting a summary of care. You'll notice that a couple of these measures have asterisks next to them. I'll talk about the reasons why on the next few slides. So you'll notice if you're reporting under the 2018 ACI transition measures, there's only 4 that you'll need to be reporting under. And those are the security rule risk analysis, e-prescribing, providing patient access, and health information exchange. So this chart is designed to kind of drill this down and make it more easy for you all to understand, depending on which objectives and measures you're reporting under, 2018 ACI objectives and measures or the transition measures. So as you can see, you'll have to select yes in order to be successful for both the transition and the just traditional objectives and measures for the security rule risk analysis. And again, you'll need to perform this measure on at least one patient throughout your practice for the performance year. And as you'll note, the asterisks reference an exclusion. So there are certain exclusions available that you or your practice may be eligible for, and those exclusions apply to the e-prescribing, sending summary of care, and requesting or accepting a care summary. So this graphic drills down a little further and provides more detail regarding the exclusions for the advancing care information objectives and measures base score requirements. So as I mentioned, electronic prescribing is one of the measures where you may be eligible for an exclusion. And you may be eligible if you're a MIPS eligible clinician who writes fewer than 100 permissible prescriptions during the performance period. In order to qualify for the send summary of care measure exclusion, You'll need to be a MIPS-eligible clinician who transfers a patient to another setting or refers a patient fewer than 100 times during the performance period. And finally, in order to qualify for the request accept a summary of care exclusion, you'll need to be a MIPS-eligible clinician who transitions care or referrals or has patient encounters in which you have never before encountered the patient fewer than 100 times during the performance period. This next slide also details the exclusions if you're reporting under the transition measures. The e-prescribing exclusion is the same. And then notice the health information exclusion. You can qualify for that if you're reporting under the transition measures if you are a MIPS-eligible clinician who transfers a patient to another setting or refers a patient fewer than 100 times during the performance period. So it's very important that you understand the exclusions if they apply to you. If you do qualify for these exclusions, you still can receive a base score, but you will need to report a 0 in the numerator or denominator for the applicable measure, showing that it applies to no patients. And the most important significant takeaway here is that you claim the exclusion through attestation or EHR reporting. If you claim these exclusions, you'll meet the base score requirements with a 0% performance score for the measure. And as I mentioned, if you don't report a 0 in the numerator or denominator for measures without reporting the exclusion, it is fatal to you in this performance category, quite honestly. You wouldn't meet the base score requirements, and you would receive a 0 for the overall ACI performance category score. So again, very, very important that if these exclusions apply to you, you document them appropriately and you submit an attestation or submit it appropriately through your EHR, so you can avoid receiving a 0 for the overall ACI performance category score. Now we'll jump into the second component of your ACI score, which is known as the performance score. So your potential for earning points in this category is 90%. So there's 90 points available in the performance score. For each measure with a numerator and denominator, the percentage score is determined by your performance rate. Most measures are worth a maximum of up to 10 percentage points, but there are 2 measures that are included in the 2018 transition measures that are worth up to 20 percentage points. So this graphic is designed to give you a better understanding of what the measures are and the allocation of points. And so ultimately, what we recommend is you select measures in this particular category of reporting performance scores that you expect you will do well in. And as you can see, there are different measures for if you're reporting under the transition measures or if you're just reporting under the 2018 ACI measures. And you'll notice that providing patient access and health information exchange under the transition measures are worth up to 20 percentage points. So you have an opportunity to do even well and boost your score if you happen to select those measures and you expect to do well in those measures. So let's go through an example of how the performance score is calculated. So let's say you're a MIPS-eligible clinician and you submit a numerator of 85. So you performed an action for 85 out of the 100 total patients for the performance period. And this is particular to the patient-specific education measure. So your performance rate would be 85%. The charts below outline how CMS calculates the performance rates for each measure. So as you can see, you go down to the performance rate section and you can see the range of 81 to 100 is 9%. So since your performance rate was 85%, you would earn 9% out of the maximum 10% for that particular measure. So this clinician did well. The third component of your ACI score is known as the bonus score. And so if you are choosing to report under the 2018 ACI objectives and measures, there are 3 different opportunities for you to earn a bonus score. The first is if you report to one or more of the following public or clinical health data registries not reported under the performance score. And some examples of that include immunization registry reporting, electronic case reporting, public health data registry reporting, and clinical data registry reporting. You could also earn up to 10% of bonus points if you report certain improvement activities using certified EHR technology. And then, as I've mentioned before, if you are reporting exclusively using 2015 certified EHR technology, CMS will allocate 10% bonus points to you in your final ACI score. If you are still reporting under 2014 certified EHR technology and you're using the transition measures and objectives, there are still bonus opportunities. They're just a little bit more limited for you. And again, the public data reporting is still an option. You can receive up to 5% bonus points for that. And also, if you're reporting certain improvement activities using certified EHR technology, you could also earn up to 10%. So there are still bonus opportunities for you if you're using the 2014 edition of certified EHR. However, as you can see, using 2015 really does give you more opportunities to score higher in this performance category. So as I've mentioned, kind of bringing this all full circle, the ACI category is weighted at 25% of your MIPS final score. As you can tell, you can score over 100% or 100 points in this category, and that's because CMS wants to give providers flexibility and ability to score well. But note that any score that's greater than 100% is capped at 100. So say you earn the full 165, CMS will only allocate the full 100%, meaning that you will only receive the full maximum 25 points for this particular reporting category. So the ACI category is the sum of the following three. It's that base score that is valued at 50%, then 90 points or 90% you are eligible to earn in the performance score category. And then finally, you have an opportunity to earn those bonus points, and you have the chance to earn up to 25%, totaling 165. And this graphic just details that again. So your total ACI performance category score is comprised of the base, plus the performance, plus the bonus should you choose to report a bonus score. So again, if your total points, base plus performance plus bonus equals 100 or greater, you will receive the full 25 points for this reporting category. However, if your total is less than 100, you will receive a corresponding percentage of 25 points. So let's say, for example, you're a clinician, you earn a base score of 50, and you earn a performance score of 40%. And then you didn't have a bonus score, so the bonus score opportunities you didn't take advantage of. So for that case, you would earn an ACI performance category score of 90. When that's weighted by 25%, this would add up to 22.5 points. So you take that 90%, 50 plus 40, base plus performance, no bonus, times 25%, which is the weight that this category is weighted at, and your MIPS score for the ACI category would be 22.5 out of the potential 25. So we'll go through some more scoring examples just because this is quite complicated to understand, and we're going to do our best to try and help you understand it. So if you are choosing to report under the transition measures and objectives, we're going to go through a quick summary of how your base, performance, and bonus may be scored. So this particular clinician selected yes for the security risk analysis, and they saw 30 out of 750 patients they performed the e-prescribing measure on. 250 of their patients they provided patient access, and 650 they provided health information exchange. So as you recall, the base score, all it requires you to do is select yes for the security risk analysis and perform the action or for the measure for at least one patient during the performance year. So as you can see, this clinician met those base requirements and fulfilled the base score, earning 50% or 50 points. Now we get into the trickier part of scoring, which is the performance score. So as you can see, This particular clinician picked a couple of different measures in the performance score category that he or she thought they would be successful in. So for providing patient access, again, that clinician performed that action for 250 of their 750 patients. That is translated to a 33% performance rate. And if you recall, the providing patient access measure for the transition objectives and measures is worth up to 20 points or 20% that you can earn when calculating your percentage score. So if you go back in your mind to a couple slides before the breakdown of the chart, you can see that a performance rate of 33% would equal to 8% out of the total 20 possible percentage points for this particular performance measure. Again, as you can see going down the list for health information exchange, this clinician did pretty well in that category, earning a performance rate of 87%, and that ended up being 18% out of the potential 20% for their percentage score. For viewing, transmitting, or downloading, for that measure, they did fairly well in that as well, earning a performance rate of 63%, which translates to 7 out of the potential 10 percentage points for the performance score. And then for secure messaging, the clinician did not as great in this category, but still earned 2% of the 10. And then for medication reconciliation, the performance rate for this ended up being 33%, but as you can see, this percentage score for this measure is only worth 4 out of the 10% because this was not a measure that CMS has selected to be eligible for up to 20 percentage points. So when you sum up the percentage score, you'll get a total performance score of 39% for this clinician. This clinician also chose not to report a bonus score. They did not have 2015 certified EHR technology, so that option wasn't available to them, and they weren't able to meet any of the other bonus score opportunities. So unfortunately for this clinician, they did not report a bonus score, and their bonus score will be 0%. So how do we add this all together, and what does that mean? So again, this clinician was reporting under the transition objectives and measures. Their base score was 50. Their performance score was 39. They did not earn a bonus score. So when you total that up, it equals to 89%. We take that and multiply it by the weight of this category, which is 25%, so 89 times 25%, and we get to 22. So this clinician did fairly well in the advancing care information category. They earned 22 points out of the potential 25. So now we'll talk about, and this may apply to you or your practice, when the ACI category may be reweighted. And this is just depends on whether or not you qualify. So you'll have to meet certain criteria in order to qualify for reweighting of this performance category to 0%. This ultimately means that the ACI performance category is not included in your MIPS final score. And CMS has reiterated numerous times that not having certified EHR technology is not sufficient in and of itself to qualify for reweighting of this category. So now let's try and determine if you may be eligible to qualify for an automatic reweighting of this category by CMS. If you're an ASC-based MIPS eligible clinician, you might be eligible for the automatic reweighting. If you're a hospital-based MIPS eligible clinician, indicated by place of service codes 19, 21, 22, or 23 on your CMS 1500, you will be eligible for the automatic reweighing as well. And we'll talk about in further detail what it means to be hospital-based in the next slide. Additionally, if you're a PA, an NP, a clinical nurse specialist, or a CRNA, you will be eligible for automatic reweighting as well. And if you're a clinician who lacks face-to-face interactions with patients, you will also be eligible. It's important to know if you are reporting in the MIPS program as a group, all of the MIPS clinicians in the group must qualify for the reweighting. So very important that if you are reporting a group, note that every single eligible clinician and practitioner has to meet the exclusions noted above to qualify. And please also note that reporting in is optional, even if you are, let's say, for example, a hospital-based clinician. You can still report in the ACI category, but also note that you will be scored just as if you were not eligible for reweighting. So very important if you do choose to report that you do so well. In order to qualify as a hospital-based MIPS eligible clinician, you have to furnish at least 75% or more of your covered professional services in the inpatient, on-campus outpatient, off-campus outpatient hospital, or emergency room settings. So if you are enrolled as an individual in the MIPS program, 75% of your professional services have to be furnished in one of these care settings. If you're reporting as a group or a virtual group, all of the MIPS eligible clinicians in your group have to furnish 75% or more of their covered professional services, again, in those care settings, inpatient hospital, on-campus outpatient, off-campus outpatient, and the ED settings. If you're a type of MIPS eligible clinician that will qualify for the automatic reweighting, you can still choose to report if you'd like. Like I said, still an option available to you, but make sure that you do so and you meet all the base requirements, you can do so well. If you submit your data, CMS will score your performance category, weighing the ACI category performance at 25% of your MIPS final score, and will treat you as if you never were eligible for reweighting. There's also an opportunity to get reweighting if you're a MIPS eligible clinician who has one of these following reasons. So you might be considered in a small practice, which is 15 or fewer eligible clinicians. So if you are in a small practice, you may be eligible for reweighting as well. If you're using decertified EHR technology, if you have insufficient internet connectivity, or if you happen to run into extreme and uncontrollable circumstances, which we'll talk about in a little bit greater detail in the next slide, and whether if you have any control over whether your certified EHR is available or not is also a potential option for you to get automatic reweighting. So if you are applying for automatic reweighting based on a hardship exception or based on the extreme and uncontrollable circumstances exception, it's important that you report it accurately. You must select one of the following and provide a start and end date of when the circumstances occurred. And this comes up in the context of a natural disaster, hurricanes, tornadoes, where your certified EHR was damaged or destroyed. It also will come up in the context of if your practice or hospital is closing, or if your practice or hospital is in severe financial distress, including bankruptcy or debt restructuring. Once your application for the hardship exception is submitted to CMS, you will receive a confirmation email that your application was submitted and is either going to be pending status, approved status, or dismissed status. The 2018 hardship application is not yet available, but will be made available later this year. And when it becomes available, the applications will be processed by CMS on a rolling basis. So when you are applying to reweight this particular scoring category, you need to submit your application by December 31st, 2018 at the latest, in order for CMS to reweight your performance category to 0. CMS is going to provide some detailed information about when the application is available and additional sub-regulatory guidance on the application, but to date, unfortunately, we just don't have that at this time. So we are awaiting further guidance from CMS on that. So with all of this being said, let's try and talk about and drill down how we can maximize points in this category. I know this category is quite complicated in terms of how it's scored, but there are some practical takeaways for you and your group to ensure that you're able to maximize points in this reporting category. As I mentioned earlier in the presentation, the base score is absolutely integral to meet those minimum requirements. If you fail to do so, you will earn a 0 in this particular performance category, which is extremely detrimental to your overall MIPS score. So again, very, very important that you meet the minimum base score reporting requirements for this performance category. With respect to the performance score, performance measures, we recommend that you select measures that you expect to do well in based on your practice and your patient mix. So select measures that you think that you will do well in. The performance score is a great opportunity for you to boost your overall ACI score. And if it's possible, use 2015 certified EHR technology. That will allow you to earn that up to 10% bonus point. So again, a great way for you to maximize your score in this category. Also look for other bonus point opportunities that you and your practice might be able to achieve. Again, just another way to boost your score. And if you happen to qualify for a reweighting or a hardship exemption, make sure that you timely submit your exemption applications to CMS. It's very, very important. Otherwise, if CMS doesn't receive that information on time, you will unfortunately be dinged in this performance category, and that will definitely hurt your overall total MIPS performance score. So the last slide talks about what we will be going through in the next series of our MIPS macro webinar. And as you can see, for August, we will be taking a deeper dive and understanding the requirements for the improvement activities category. So we look forward to speaking with you in the next few months and providing you with further information regarding the MIPS program. And again, our contact information is on the slide. To the extent that you have any follow-up questions, please feel free to reach out or send a message to Victoria in the chat, or you can reach out to me or Brian Bauer. Our contact information is listed below here.
Okay. So I have all of the lines are now unmuted. So if you have a question, you can go ahead and feel free to ask it, or you can type it into the chat feature and I can read the questions aloud. Okay. If we don't have any questions or comments, we can go ahead and sign off. Or if you think of any questions, feel free to email me or email Brian or Lisa directly, and they can answer any questions that you might have. And as I mentioned before, all webinars are recorded and will be posted on our website. So please feel free to listen to them again. And then if you have any questions, feel free to reach out to Brian, Lisa, or myself, and we will get your questions answered. Thank you for joining us this morning and have a great day.